warm welcome to you, everyone. I'm so happy to see that there's many of us here present in this meeting. There's great interest in these issues, apparently, and we're very happy for that. My name is Maria Helling. I'm the CEO of Swecare Foundation. Swecare is an organization, a semi-governmental organization. We're working very closely with the Swedish Ministry of Health and Social Affairs, and our aim is to support internationalization of the Swedish healthcare and life science sectors. We create partnerships with different countries, and since a few months back, we run this project aiming at connecting and supporting to transform and improve the Ukrainian healthcare system. So this webinar is the first in a series of webinars that will hopefully spread some knowledge and connect people. And there will also be many other kinds of activities coming on. And we hope that all of you will be part of that, of course. I'm looking forward to this morning and the presentations. It's an interesting and important topic, of course. But before we start with the presentations, I would like also to introduce Petra Andersson Erhardy, who is counselor at the Embassy of Sweden in Kiev. Please, Petra.
Thank you so much, Maria, and I'm very, very happy to be here. I am a relative newcomer to the embassy and to Ukraine, but only after 2 weeks here, I'm extremely impressed by the country's effort, successful effort, I should stress, in upholding this sense of normalcy in society and functional institutions, even in the midst of Russia's war of aggression. I would just quickly give you a little pitch from the embassy's point of view. As you all know, Sweden is committed to support Ukraine in many ways, politically, militarily, economically, and through various types of aid. And as you also may know, the government last year adopted a new strategy for Sweden's recovery and reform cooperation with Ukraine for 2023-2027. And it's our largest ever bilateral development strategy, as it allocates more than €500 million in support for Ukraine for that period. And the overarching aim of this support is to contribute to Ukraine's EU integration with a focus on recovery and reform, and also to the strengthening of Ukraine's freedom, resilience, and economic prosperity. And I should stress, in doing so, doing it in such a way that it fits with Ukraine's own needs, priorities, and build back better approach. And the healthcare sector is specifically mentioned in the strategy. It's also a priority for our trade promotion work here in the embassy, as it is an area where Swedish companies have a competitive advantage. Sweden is a country of engineers that have achieved many innovative and cutting-edge solutions within the sector, and many Swedish healthcare companies are already present. They have an established presence on the Ukrainian market and a proven successful track record here. So this includes Elekta, AstraZeneca, Getinge, Medicover, known here as Cinevo, among others. And we in the embassy would, of course, like to see many more Swedish healthcare companies working with Ukraine, and we have a big team ready to support you, and in Ukraine, but also in Sweden. We have the political and trade promotion section here in the embassy. We have Business Sweden here with our newly opened trade office. And of course, in Sweden, we have Swecare. We also have a newly appointed Swedish special envoy, Ulrik Tideström, who will deal specifically with private sector involvement in reconstruction of Ukraine. So these are some parts of the team. And this means that we are ready to provide quite concrete support to Swedish companies here. This includes assisting in organizing events and meetings, perhaps helping companies to address any issue that may occur by raising potential thorny issues or particular needs with the relevant authorities here. So I will stop there. I would like to thank very much Swecare for organizing this event so Swedish companies can learn more about the Ukrainian healthcare system, to get an idea of the space for opportunities and synergies in this market. And just to stress that alongside the political and financial support to Ukraine, trade and investment, including health in the healthcare sector, is an important pillar of Sweden's bilateral relationship with Ukraine. So thank you all, and thank you for inviting me. Wishing you fruitful discussions.
Thank you very much, Petra and Maria, for welcoming words. And let me introduce Nataliia Husak, the head of the National Health Service of Ukraine, that will share about the important role of National Health Service during the reform during the war.
Good morning, dear colleagues. I'm happy to be here together with you. And first of all, I would like to thank Sweden for the support provided to Ukraine during this war of aggression. Thank you, Maria, and thank you, Petra, and thank you, Katerina, for having this opportunity to organize a meeting like this and to present all our experience, not only working during the full-scale invasion, but also the experience of the transformation of the healthcare system that was unfolding during the extra difficult times for our country. So it all started back during the pandemics, and now it's during the war. But one way or another, we as an executive body, so on a daily basis, on an hourly basis, we're trying to make sure that the Ukrainian patients receive the access to high quality and free of charge medical services, and to make sure that the healthcare system of our country remains resilient despite all the challenges that we're faced with today in our country. So today, let me present you the National Health Service of Ukraine and our role in building the healthcare system, building a new health care system in Ukraine, the post-Soviet system. So if I may, Katerina, could you please jump to slide 3? So the healthcare system and the function of the healthcare system in Ukraine is ensured by a number of public authorities. And of course, the public policy development is next slide, please. So it's done by the Ministry of Healthcare of Ukraine and the Verkhovna Rada of Ukraine. So the Verkhovna Rada of Ukraine, the parliament, just like the parliament in any country, adopts laws based on which the healthcare system is functioning. The Ministry of Health of Ukraine develops the state policy, and this policy is adopted by the Cabinet of Ministers of Ukraine, and the National Health Service of Ukraine is subordinate to the Cabinet of Ministers by way of the direct management of the direct subordination to the Cabinet of Ministers. Also, we have the Public Health Center of Ukraine, and we have the Public Enterprise Medical Procurement that are responsible for the centralized procurement of medicines and medical devices and the equipment. And of course, together with the local self-governments, which are the owners of the communal non-profit medical institutions. So we cooperate with the local self-governments to make sure that we implement the medical guarantees program, and also to implement our strategic procurements in the medical institutions. And we also have, and I'll be mentioning this in detail later today, we also have state enterprise electronic health. So it administers an e-health electronic database, and the National Health Service of Ukraine is administering this database. Next slide, please. So if to talk about the transformation of the healthcare system of Ukraine, it started back in 2018, and it started from the following. So, as I said, before 2018, the whole healthcare system in Ukraine was, this kind of a classical example of a Soviet-type system and a Soviet system, Semashko system, so-called. And the idea was that the funding of the medical institutions was done not based on the results, but solely based on how on their availability, basically. And in 2018, we created the National Health Service of Ukraine, and it became the strategic procurement body, and we started to purchase the services on the primary healthcare. So Ukrainians were free to choose their primary care physician, and they signed declarations with them, and the National Health Service of Ukraine was paying for this care provided and for the primary care. And in 2019, we had the transfer to the Affordable Medicines Program, which is administered by the National Health Service of Ukraine. So we're procuring and reimburse the medicines which are necessary for people with chronic illnesses. And starting from the 1st of April 2020, we started to procure the medicines for the cardiovascular diseases and type 2 diabetes mellitus. And also we were getting ready to start procuring the specialized care services. In 2020, we had the launch of the program of medical guarantees. This is our primary tool, which helps to protect Ukrainians from catastrophic expenses and ensure some public support in all institutions of all types of property. And today, the program of medical guarantees covers primary health care. So we're procuring the services of emergency medical care, of specialized medical care. This includes priority areas such as the stroke, infection, surgery, delivery. Also, we're purchasing the rehabilitation services, which are extremely relevant today for the country, which is in the circumstances of a full-scale war. So we are also purchasing the palliative care services. And as I said, we are purchasing medicines through the reimbursement program and the affordable medicines program. Next slide, please. So as I said, the National Health Service of Ukraine is a national payer. So we administer our main tool, which ensures the guaranteed medical services packages, is the medical guarantees program, and we are administering this program. Besides, we are carrying out strategic procurement through evaluating the demand for the medical services, and we employ different mechanisms. And also we're using the electronic database, which is the main source of payment for medical services. Next slide, please. So the main tasks of the National Health Service of Ukraine is not limited only to payment. So as I said, by administering the Affordable Medicines Program, we are making sure that these funds are used transparently and with accountability. And as part of this, one of our tasks that we started to develop is to monitor on executing the contracts with the healthcare providers. So maybe you are interested how we ensure the strategic purchase, so they are insured through the contracts with the service providers. And by identifying the conditions and the specifications of these procurements and the services provided. Also, we are looking at the complaints of the patients about the services provided, and also we're ensuring the functioning of the e-health electronic database system. Next slide, please. So as I said, essentially the National Health Service of Ukraine, as this is the team that designed the transformation of the healthcare system, and starting from 2018, we implemented a new mechanism of funding the healthcare system. So before, that was a purely Soviet-based like accounting approach, when medical institutions were financed based on their needs and per item budget basis. And from there, we moved to the procurement of medical services selected by the users, and depending on the availability of services. And also we moved to paying per result. And also we are tracing the quality of the services delivered. Next slide, please. Also, I'd like to mention that the National Health Service of Ukraine is closely connected with the following. So we have changed the funding approach, and this new approach follows the principle that the money follows the patient. And this is basically the results-based principle of payment. So the patient is free to choose the institution where they sign the contract and choose the physician that they sign the declaration, and then the National Health Service of Ukraine pays for these services or receive this or that medical service. And then we set the relevant tariffs for the relevant services, and these tariffs are identical for all the providers, both in the public and communal and private sector, and the patient has the possibility to choose these services and to choose both the institution and the physician, and the National Health Service of Ukraine will pay for these services. Next slide, please. Next one. And one more. So I've mentioned that already, right? So when using the relevant so the National Health Service of Ukraine is using the electronic health system, and as part of the IT tools, we are developing processes of procurement, of contracting, and also of monitoring these medical services provided, and also the execution of the contracts. So the e-health centralized database helps to develop large aggregations of data, electronic data, and we, as the owner of the electronic system of healthcare, we have the possibility to analyze this data and to reach some management decisions, and to also make some proposals to the medical guarantees program that we submit to the Ministry of Health Care. And also we make decisions about some selective contracting. And again, thanks to this electronic healthcare system, we ensure automatic monitoring. Next slide, please. So if to speak about one slide back, please. If to speak about 2022, so what is the strategic procurement about? So we are developing the principles of what we are ready to purchase, who we are ready to purchase it from, and how we're going to purchase this or that service. And in most cases, the majority of all the services are purchased using the identical approach. So we purchase from the communal enterprises and from the private enterprises. Next slide, please. But at the same time, we see that annually, Katerina, could you please move the next slide? Yes. So annually, we have the increased number of partners from private institutions and also the individual entrepreneurs. So we have physicians who are registered as private entrepreneurs, and we have more and more contracts signed with them. So this growth of these private partners is also ensured by the following. So despite the war, we are reliable partners when it comes to paying for the guaranteed services. And also we see that the tariffs, the procurement conditions that are suggested by the National Health Service of Ukraine are attractive also for the private sector. So annually, despite the war, the private sector is also becoming the is signing contracts with the National Health Service. Especially this is relevant for the primary care, and we have an increased number of private partners in rehabilitation services. And this year we have two partners in the outpatient area. So this is the Sineva company that was mentioned by you, which has some of which has Swedish partners. Next slide, please. So when we prepare the approaches I'm sorry, I can't hear because someone else is speaking. Can you please tell them to turn off the microphone? I can't hear the speaker. So we must ensure the financial protection of the Ukrainians against the extremely high expenses. Of course, we are ensuring this gradually because the transformation of the medical system was faced with three great challenges. So the first one was the resistance of the Soviet-type medical system. The second challenge was the pandemic, so that was a global challenge. And the third challenge is the war. But all the evaluations of international partners, they prove that the household expenses are reduced when it comes to paying for the medical services. Also, what is important for us is the universal coverage and fair access to the medical care of all the Ukrainians who need those services. Also, as the Central Executive Authority, we are always following the principle of transparency and accountability, and this principle is relevant not only for the accountability with the Cabinet of Ministers or the Ministry of Healthcare, but also being accountable to the society. And on our website, you can see all the payments which are done to the medical institutions, and also we have annual reports as the purchaser of the healthcare services. And of course, what is important for us is to make sure that the funding that we administer as part of the medical guarantees, and this year it's 159 billion of budget funding, so we must ensure that this is done and used efficiently, and to make sure that every hryvnia, every penny is used in order to ensure high quality and accessible medical services. Next slide, please. So as I said, the medical guarantees program is developed from the funding of the state budget, and as I said, this year it's 159 billion, and we've paid out more than 39 billion of budget funding to the providers. Last year, we paid 129 billion of budget funding. So of course, there's reduced demand to certain services, especially when it comes to delivery. So because a lot of people emigrated, and so we have the reduction of pregnant women in Ukraine, but at the same time, we see that we have an increased demand for the treatment of chronic illnesses because of the stress. So there is a need to treat also the strokes, which became more frequent, and also infections and heart attacks, basically, and also surgeries becoming more relevant. So we primarily are talking about the injured servicemen and women, and those who are treated in the civil medical institutions. And other important areas are rehabilitation, because we have an increased demand for rehabilitation due to war trauma, and also the chronic illnesses such as stroke, for example. And also we are developing the procurement of services of psychological support, which again are extremely important today. Next slide, please. So in this slide, you can see that despite the growth of the medical guarantee programs, of course, we have the increased number of payments in the private sector. And in 2021, for example, the private sector received only about 1 billion of budget funding. So this year we paid almost 3 billion of budget funding to the private sector. So the payments are growing to the physical persons, entrepreneurs, private entrepreneurs, who are providing medical services starting from the primary care and all the way up to rehabilitation, palliative care, outpatient packages, laboratory diagnostic tests, and other types of services, including the oncology treatment offered by the private institutions and paid for by the National Health Service of Ukraine. Next slide, please. It goes without saying that the year 2022, February 2022, it required very prompt decisions from us. And the experience, other European countries luckily did not have any experience with this when it comes to procuring medical services during a large-scale invasion. And we realized that we have a number of regions where the principle that money follows the patient would not be fair, because we had some family physicians and some hospitals with their patients that are placed in the territories of active hostilities. So they need to be funded, of course. So we are trying to constantly regulate our policies, and we're trying to find the solutions to make sure that these institutions can receive fair payment and people could have access to all types of healthcare services. And of course, we have a unique experience procuring medical services, healthcare services, how you can procure services and ensure access to almost all medical services, both in the areas of active hostilities and also in the short-term zone on individual occupied territories, because Kherson was occupied, and Ukrainians were able to receive medication through the affordable medication program, and also a number of services were also provided when Kherson was under occupation. I'm sorry, there is no sound from Nataliia Husak. No sound available, sorry.
Pani Natalio, can you hear us?
Yes, I can hear you. What happened? Where did you miss me? Why did you stop hearing me? Okay. So despite the war, we continue with carrying on with our main processes, developing our main processes. We are continuing to improve them, and we have our own unique experience of pursuing all the operational plans. We continue to develop the electronic medical system, healthcare system, and also we continue to develop the affordable medications program and also the medical guarantees program. And as I said, we understand the demand for new services which are relevant for Ukrainians now. And also we're developing our operational processes. So this year, for example, we decided to move to the midterm purchasing of medical services and also to adopt midterm contracts. So this will make sure that our partners feel more confident and are able to plan their activities better. So we are making 3-year contracts, and also we are trying to make sure, next slide please, we're trying to ensure the efficiency of the procurements. So as part of developing the electronic healthcare system, in 2024 and in 2023, we did massive verification of the personnel that we have in the medical system and also the patients who receive healthcare services through the integrations of various registries, through the integration of registries and also through implementing the ongoing monitoring. And thanks to this, we can use the funding fairly and efficiently and purchase the services from those institutions that are working efficiently and fairly. And also in 2023-2024, we have been developing our monitoring function. And last year, we launched the initiative on developing a new monitoring system. And now we have the possibility to carry out actual and ongoing monitoring and to make sure that the contracts that we have with the medical institutions is working for the benefit of the third party, for the benefit of the patients. So in the first half of the year, we carried out some monitoring in 4 areas. And in the second half of the year, we're planning to develop these areas. This is the next slide, please. So this is all from me, and I'll be happy to answer your questions. And thank you for your interest. And I'd like to say that as the conclusion, I'd like to say that despite all the challenges that you've heard from me, the National Health Service of Ukraine remains committed to the changes and to reforming the healthcare, and we are committed to protecting the patients. And extremely important for us to make sure that the medical healthcare system is transferred from the Soviet system to the patient-centered medical system, and that's why we do everything. We're coping with the management challenges. So as part of the public service reform, we had some cuts on the personnel. So we are basically doing the impossible compared with our colleagues from other European countries. So that's something I'm confident about. So we're doing the impossible. If you look at the number of personnel, number of colleagues that we have in our team who continue to transform the healthcare system to make sure that it's more focused on the patients and more focused on the patient's needs. Thank you.
Thank you very much, Pani Natalia. And we have time for one question or maybe two.
Thank you very much for presentation. It was very valuable information. Just my question is about digitalization within the healthcare, especially primary care. And we are working with remote patient monitoring in Sweden, market leader, and which means that we are helping a lot of patients with chronic diseases by digitalization and remote patient monitoring. So how is the status of digitalization in the country? And what about the reimbursement model? Is it a part of primary care services this kind of the chat, video, and measurement of, for instance, blood pressure, blood sugar, and so on?
Thank you for your question. So, as I said, we are the owners of the electronic healthcare system where we aggregate the medical data about the patients, and we have a number of so we are aggregating this data, and we have the interaction with the medical information systems, and they belong to the private sector in Ukraine, and they are working directly with the service providers, with the medical institutions. And in 2023, as I said, we did not refuse from any of our goals. And in 2023, the government and the Verkhovna Rada, the parliament, adopted a number of important changes to the legislation associated with the telemedicine services, the services that you're mentioning. So the telemedicine, as part of the National Health Service of Ukraine, they are included in many areas. So this is the primary care, as I said, and this is also the diagnostics. It's also very important, especially when you have very few staff, medical staff, medical professionals who are responsible for a large number of populations. For example, the high quality of CT diagnostics, and we are just at the start of building high quality telemedicine services, but the first steps have been done in 2023, and in 2024 we have been integrating this into the healthcare institutions operations. So as the purchaser, we are paying for the relevant service based on a lot of services, both from the telemedicine and also the services provided directly in the contact with the patient.
Who we can approach in this sense? I'm happy to hear those news, but who we can approach in the market? Is it the national health institution, or is it the primary care, private or public? How we can do it? Thank you very much.
Дякую. So when it comes to the telemedicine tools, they are developing by the medical information systems, so the private sector. We have a state enterprise called Electronic Health, and this is a state enterprise which is administering the electronic healthcare system, and it's interacting with the medical information system. So the state enterprise eHealth, it's developing all these interactions when it comes to developing this cooperation, including the telemedicine services. So I believe that me and Katarina could pass on the contacts of our colleague from the eHealth, Mr. Alexander Yemets, and I'm sure that they are very motivated to develop this partnership and also to learn the best experience and best practices integrated into Ukraine.
I appreciate your support a lot. Thank you very much. If you can share those contact details, I will take the action. Thank you.
Thank you very much, Pani Natalia, for your presentation, and thank you very much every participant who asked your question in the chat. We will follow up with the answers by email because now we have to go further.